Ms. Kristensen, welcome.
Thank you.
You work in Denmark. Am I correct to assume that Denmark is in the forefront of patient safety, especially when it comes to the empowerment of patients?
You assume right, yes. We have in Denmark had patient safety work, which has been structured and systematic since we had the first law on patient reporting of incidents harming patients in 2004. And over time, we've also learned to engage patients in patient safety work through initiatives on the clinical level, but also through a lot of national campaigns. Yes.
What do's and don'ts have you encountered when it comes to incorporating patients on the subject of patient safety?
Well, we're still in early days of this, basically, but one of the things that we have learned is it helps to communicate with the patients, tell them what to expect, how to go about a pathway that they might experience in healthcare, tell them what should they know when they meet the doctor, that what should they ask for, and these kind of things.
Okay. So what a patient then needs is transparent information. There's a lot to do about this in Holland. Is the same subject important in Denmark?
Oh, very much so. We have in the Danish Society for Patient Safety, where I work partly, we have developed quite a few tools, and one of them has to do with asking once you get in touch with healthcare. One has to do with a trustworthy healthcare system and communicating, also engaging your relatives, because more people might be listening better and understanding better what is said, actually.
And do healthcare professionals easily accept a more active role from patients?
Not easily. It has to do with a shift of mindset over time. But one thing is to create a so-called social movement in the population, that people know what they can expect, how they can go about a visit to healthcare. The other thing is also to address healthcare workers, that they know more about how to be open with patients. But I think over time we have decreased the cooperation with the patients in healthcare. We still have a long way to go, nonetheless. Yeah.
Do they understand the argument that probably healthcare gets safer once the patient is more involved with his own treatment?
I think it depends on what kind of patient groups you're talking about. Generally, we have very sick people once they are in hospital, so that might be problematic, but in ambulatory care or at the GP, that's a different matter. It's also a different matter of how to involve citizens in healthcare work once they are in nursing homes. So you would address in different ways, and you would also expect different ways of involvement for these different groups, obviously. Yeah.
Okay. By hearing your story, I can understand other European countries can learn a lot from Denmark. What about the other way around? Can Denmark learn from other European countries?
Oh, definitely. We are at the moment very much engaged in a EU project called the PASCA project. And one of the main targets here is actually to exchange knowledge, exchange experience on goods and bads, what to do and what not to do in patient safety. And we are just in the project finalizing an action plan on exchange of knowledge within the different member states of Europe. And the topic that Denmark is dealing with is improvement strategies that have shown themselves effective in enhancing patient safety. And we're looking towards Scotland, Ireland, Holland also, and to some extent also to Spain. We want to know which is the best way to improve, actually.
Yeah. Do you think European countries could actually work together on a more practical level too, maybe sharing financial resources or?
I think we're not there yet. I think there are different streams in Europe. There are some of the countries in patient safety that have worked with patient safety for a very long time, and they might not be so interested in having a centralized or a standard throughout Europe, where other countries might be more interested in this matter.
Okay, but for now the most important thing is to actually really exchange experiences, exchange people, doctors, etc.
Exactly, that's quite an important thing, that we can actually lift this task together, also in terms of cross-border care, that we will ensure that patients wherever they go are provided with the same quality of care.
Thank you.
Thank you.